Have you ever noticed how, after an injury, even when the swelling starts to go down, the muscle just doesn't seem to wake up? That's not just weakness, that's something called Arthrogenic Muscle Inhibition, or AMI. And this is exactly why early rehabilitation is so important. When a joint gets injured or swollen, it sends abnormal signals to the spinal cord. These signals reduce the excitability of alpha motor neurons, meaning your brain cannot fully activate the surrounding muscles. The muscle isn't damaged, but it's neurologically inhibited. This reflex is protective at first, but if it continues, it becomes the biggest obstacle to recovery. That's why early intervention is critical. Using strategies like cryotherapy and TENS can reduce this neural inhibition before you start full rehabilitation. Cryotherapy cools the joint and decreases inhibitory interneuron firing, helping the muscle regain voluntary control. TENS stimulates superficial sensory nerves, disrupting abnormal joint feedback and allowing normal motor output to resume. These techniques create a more normal muscle state, preparing the patient for active rehabilitation. Once volitional control returns, we can start isotonic, single-joint exercises, especially open kinetic chain (OKC) movements, to isolate and activate specific muscles safely. Later, we progress to closed kinetic chain (CKC) exercises to reintegrate coordination, strength, and stability through functional movement. Why start with open kinetic chain exercises? Early in rehabilitation, after injury or surgery, several physiological challenges exist: pain, swelling, and arthrogenic muscle inhibition (AMI) reduce muscle activation. Weight bearing may be restricted due to tissue healing or surgical protection. Joint stability and proprioception are not yet restored. So, OKC exercises are ideal in this stage because they allow precise control of movement and load. Can isolate weakened muscles, e.g., quadriceps, tibialis anterior. Enable early reactivation without stressing healing tissues. Are non-weight bearing, reducing compressive or shear forces on joints. Once pain and swelling are controlled, neuromuscular control returns. Weight bearing is permitted. Right pointing arrow, you move to CKC exercises. CKC exercises re-establish joint co-contraction, agonist plus antagonist synergy, improve proprioception and balance. Reintegrate functional movement patterns, walking, squatting, build dynamic stability through multiple joints. CKC is functionally closer to real-life activities, hence crucial for final rehabilitation and return to sport. So remember, early rehabilitation isn't about rushing recovery. It's about re-establishing communication between the joint and the nervous system. The sooner we normalize that link, the faster and safer the return to function.